Recognize myself for 5 minutes. Let me begin by asking unanimous consent to submit letters from organizations representing patients, providers, pharmacists, small businesses, and advocates in support of PBM reform. No objection. Without objection. The big three PBMs, vertical integration with health insurance conglomerates, enables them to exploit conflicts of interest to drive prices up, quality down, and independent pharmacies out of business. For instance, the top three PBMs steer patients and the most lucrative prescriptions to their affiliated pharmacies and away from independent competitors. The FTC's latest interim staff report on PBMs found that the big three reimbursed their affiliated pharmacies by up to 7,736% more for specialty generic drugs compared with independent competitors. Unbelievable. Take the drug pirfenidone. For example, it can be purchased without insurance for $200. However, seniors on Medicare filled pirfenidone 85,000 times in 2022 at an average cost of $8,000 per prescription. You can buy it for $200. They were charging $8,000 per prescription. 85,000 times they did that. If you do the math on that, you see that is a big number. Mr. Chancey, I want to start with you. After all, like you, I stood behind that pharmacy counter for many years, and I was the one who had to tell the patient how much the medication was. I was the one who watched a senior citizen try to make a decision between buying groceries and buying drugs. I was the one who watched the mother in tears as she tried to figure out how she was going to pay for her child's medication, and you do that as well. I want to hear from the person that's standing behind the pharmacy counter, like yourself. Can you highlight other areas of inefficiencies in our healthcare system where PBMs have impacted independent pharmacies and therefore harmed patient care?
Yes, there's several things that come to mind. One of the things that they're doing now is they're requiring brand when there's a generic available, and they're making Part D recipients pay the brand copay. Another area they're controlling access to the pharmacy. We have one patient. She's 92 years old, and her husband is 95, and they're blind. She's legally blind, and we do specialty packaging so that she knows what time to take her dose and her meds, and she wants to be as independent as possible because she's afraid that her husband's going to die and she's going to be left alone. Well, TRICARE actually took that away from us. They narrowed the network, removed us from it, and now they're making him drive like 20 minutes to a pharmacy when he's 95. So we were giving them a great deal of health care, and they took that opportunity away from us and put it to one of the big box chains. But the unfortunate thing is, this is a patient that needed care. I think there's also waste that we see in mail order. As you've already mentioned, we had one patient that we were filling specialty drugs. They demanded it go to mail order. We later found out that mail order was charging $300 over what they were paying us. I had a colleague that reached out to me with some information yesterday, and this is still bothering me. His pharmacy got turned on to a mail order reimbursement rate in the 1st of January this year. So we compared the first 6 weeks of this year with the first 6 weeks of last year, and on average, he was getting 17 times more profit on the mail order pharmacy reimbursement. You know, that's something you hope that's not right, but it is, because it's proven by the FTC and also by the 3-Axis study in Washington State.
Well, thank you for that, and thank you for that information. These are real people. These are real examples that you deal with every day, and we thank you for that. You know, I want to tell you about my Drug Transparency and Medicaid Act. It's part of the original continuing resolution that you had mentioned, Representative DeGette, from December, that includes a ban to prevent PBMs from retaining revenue from spread pricing. So are you familiar with spread pricing, Mr. Chancey? Can you talk about that for just a second?
Yes, I am. I think that it's really interesting, and I still don't understand it, why they actually pay the chains more than they pay us, and then they pay themselves more than they pay the chains. But recently, I think it was in January, we had a lady, her insurance rolled over into a new plan, but she didn't tell us. So we filled it on her old plan, and she was charged $135. Her insurance paid $135 on her plan. Well, a few weeks later, she gets a bill from the PBM saying that she owes $400. And so our pharmacist said, well, we only got paid $135. So she got on a three-way call with the pharmacist and the PBM, and they said, well, you owe $400. And she said, the pharmacist said, well, you only paid us $135. And, well, this is what the plan got charged. So that's spread pricing. $135 is what it costs to get the prescription. $400 is what the plan paid.
Thank you, Mr. Chancey, for that testimony.